Any last minute questions?
No, I think I'm good.
Good.
So we'll just, like I said, have that awkward sitting there for 10 minutes until you hear from me again. Like I said, if you want to take yourself off screen, feel free to do that, since this is considered like it's our version of a waiting room.
Okay.
Right.
I'm going to count down in a minute. We'll go live. I just renamed your screen, Eric, to Dr. Panich instead of having your name on it. All right, it's 9:50. I'm going to go live in 3. Wait, let me get off camera. In 3, 2, 1. Well, good morning, everybody, and welcome to the Healthy Living Virtual Expo, hosted by the Daily Breeze and the Press Telegram. My name is Julie Corlett. I'm events manager from Southern California News Group, and I want to thank you for taking time out of this morning to join us today. A little bit of housekeeping before we get started. I just want to let you know that this session is being taped, and a link will be sent to you. Feel free to type in any questions in the Q&A at the bottom. There's a chat bar or a Q&A bar or chat. We will be monitoring those and we'll be happy to answer any additional questions at the end of the presentation. Today's session is being sponsored by Torrance Memorial IPA. As you know, the topic is Medicare 201, reviewing the Medicare You booklet and diving deeper into the ins and outs of Medicare. It is presented today by Vince Kelly, Rose Straub, and Dr. Norman Panich. And with that, I'd like to welcome you guys.
Good morning, healthy living community in the Zoom world. Nice to see you all here. And my name is Vince Kelly. And I just realized a couple of weeks ago, I'm going to be celebrating my 35th anniversary of being in this business. July 17th, 1986, I got a job at FHP Healthcare, one of the first Medicare HMO plans. Since that time, I went to different companies in management like Blue Shield, Care America, UHP, and then 14 years ago, I went out as an independent agent. So through all those years, it was quite common for insurance companies and agencies to develop a Medicare 101 meeting for people just joining Medicare, the basics. Started to realize that we should take it a step further. Medicare's gotten a little bit more complex and with different options and rules, and hence this Medicare 201 program. And like any good classroom, that they have a textbook. And this is our textbook, the Medicare You 2021 booklet. If you have it handy now, that's good, but it's not necessary. You'll be getting a book, or anybody on Medicare gets a Medicare You 2022 booklet this October. Every year, one comes out. So we're going to be reviewing this textbook, and it's important to look at. So you can relax. Don't worry, there's not going to be any final exam or test, but get your pencils and pens ready to take notes. And I'm going to introduce Rose Straub next, who's going to start with more introduction and take over the first few slides. Rose?
Hi, everybody. Thanks, Vince. I'm Rose, and my colleague is Vince Kelly, and we are actually independent insurance agents, and we're so happy to be here. This is kind of our inaugural, I don't even know how to pronounce it, Medicare 201. And Vince and I are independent insurance agents, and all we do is Medicare. We specialize in Medicare. And we're actually, South Bay people. We live and work in the South Bay. So we know a lot of the local resources, the local hospitals and medical groups and doctors. And that is really helpful as we help you, as we help our clients. So what we do is we're here all year round, and we help answer questions that our clients have. And we also help as you transition to Medicare. We talk to you about Medicare A and B. We talk to you about when you can enroll in Medicare. We also talk about your health plan and your coverage options. We look at the different plans that are available, and we make certain that your preferred physicians and hospitals are part of that plan or part of that network. We also look at all of your prescription medicines, and we make sure that whatever plan that you're interested in is a plan that covers your prescription medicines as well as it can. And we also offer guidance with any of the health plan choices that you have. So Medicare Supplement plans, standalone Part D plans, Part D to cover prescription medicines, and your Medicare Advantage plans, your HMO and your PPO. We're actually located in Torrance. Our office is in that old Iowa courthouse building, the one off of Crenshaw, right by the 405 freeway. So we see a lot of our clients. Lately, we've been seeing a lot of our clients via Zoom, also by phone appointments, and soon we're opening it up more and more to face-to-face appointments. But there's no cost for our services. We're actually compensated by the insurance companies. So we really like that because it allows us to give an unbiased view of these plans. Our only goal is to make certain that you choose the right type of plan that's best for you. And as your needs change, we can help you with those changes from year to year. So just to confirm what Julie said, we will be having a Q&A at the end of our presentation today. And so there will be lots of opportunity for you to ask additional questions at that time. So let's go on to the next slide. And we're here to talk about this book. And this is kind of our textbook for Medicare. This is certainly something that I read through and I continue to read through when I first became an agent 7 years ago. And we get updates in this booklet every single year. And it's really a great guide. You'll get a new Medicare You booklet, as Vince mentioned, every October. It will come to you whether you're enrolled in Part A of Medicare or A and B of Medicare. You'll get one automatically. And if you do nothing at all, what we recommend is that you look at the inside front cover. Because the inside front cover, they've been doing this for 2 or 3 years now, will point out anything that's new with Medicare this year. So I'm not going to go over everything that's here on the inside front cover, but one of the things that's new this year is something called an insulin savings program. So this has really been great, actually, because it's a savings model, if you will, and it allows you to possibly choose a prescription drug plan or choose a Medicare Advantage plan that has prescription drug coverage in it that will provide supplemental benefits. And this all started in January of this year, January of 2021. So plans that participate in the insulin savings program include lots of different types of insulin and with a max copayment of $35 for a month's supply. So that's really great. That's something brand new this year. The other thing that's new this year is acupuncture for back pain. So original Medicare now covers up to 12 acupuncturist visits in 90 days for chronic low back pain. And there's more information about this further on in the book itself. Also, telehealth and other virtual services are now available. This allows you to get medical or health services that generally would occur in person. So things like consultations, office visits, psychotherapy can be done with a telehealth session instead of a face-to-face appointment, for example. So there's lots of great information just on the inside front cover. Also, there's a great table of contents on page 3 of the book, talks about the different parts of Medicare and what page you would go to learn more about that. It talks about original Medicare versus a Medicare Advantage plan. It talks about finding out if a test or some sort of procedure is covered by Medicare. So there's lots of really good information in the table of contents. And then also on page 4, it talks about getting started. So here it talks about learning about your coverage options. You've got 2 main ways to get Medicare. Find out when you can sign up and find out if you have other health insurance, how that would be covered with Medicare. And then it also talks about if you have Medicare already, how you would make a change during the annual enrollment period. So these are just a few things just to get us started. And I think Vince is going to take over. No, I'm going to continue on. So let's continue on into section 1. So on the next page, section 1 starts on page 15 of your booklet, if you're following along. And here it talks about, I'll just turn the page and go to page 17, but it talks about the 2 main time frames that you can enroll in Medicare for the first time. During your initial enrollment period, which is a 7-month period that revolves around the month that you're turning 65. But if you or a spouse are still working and you have coverage by that employer plan, you might not want to enroll when you turn 65. So then you would have what's called a special enrollment period to enroll in Medicare when you retire, and then you would transition over to Medicare. And both of those time periods, the initial enrollment period or the special enrollment period, there would be absolutely no penalty at all. These are perfect time periods to enroll in Medicare according to Medicare's rules. On page 23, I want to talk briefly about your Part B premium, because everybody on Medicare, with the exception of people that have a very low income, would have to pay a premium for Part B of Medicare. And that Part B of Medicare amount that you pay is actually dependent upon your income. And Vince is going to talk a little bit more about this, but there's something called an income-related monthly adjustment amount. This is found on page 23 of the booklet. It's also called IRMA. And what that means is because your Part B premium is determined by your income, this could be an extra charge that's added to your Part B premium, depending upon what income tier you're in. So that's very important. In section 2, on page 25, this whole section talks about find out if your Medicare covers your test, your item, or your service. And this is really cool information, because if you have a particular lab test that you need to have done, or some sort of a screening or a bone mass screening or something like that, you can tell if it's covered by Medicare. Anything that is showing with a little apple icon, if you see an apple icon, that means the test is free. If there is no apple icon, then with those items, there would be a 20% coinsurance payment. But if you have a Medigap plan, if you've got a supplemental plan with Medicare or a Medicare Advantage HMO, then those tests would be covered either completely or to a certain amount they would be covered. There's also a section, conversely, on what isn't covered by Medicare, and that can be found on pages 51 and 52. There's a little section here that says what is not covered by Medicare. So things like cosmetic surgery or massage therapy, things of that nature, would be not covered by your typical Medicare plan. So those are just the few things that we're going to touch on initially. And now I'm going to turn the presentation over to Vince. Thank you.
Thanks, Rose. Okay, so yes, the next slide we're going to talk about is going to be what Rose mentioned, IRMA. Now, if you're not a high income earner, you can just not ignore this, but you might be. Maybe you'll win a lottery someday or come into a lot of money. So as Rose said, this all started back in 2007. Prior to 2007, everyone paid the same standard Part B premium. Back then it was $88.50. So even Warren Buffett paid $88.50 in 2006. So one example of how this is not your parents' Medicare anymore. And more people are reaching these high income levels. So there's a laddered scale. We're just putting the first scale here. It's if you file taxes as an individual or a joint. They always look 2 years back. It's a 2-year look back. So it's possible you might have to pay more for 1 entire year. Now, there are some exceptions where you can request to have it lowered. Specifically, it's a life-changing event. And there's a form you would fill out. You would call Social Security, or we could email it to you, or you could find it on the internet. The most common life-changing events are when you stop work or work stoppage, because the government recognizes, for instance, if you're retired early this year in 2019, you were working, they're looking at that income from when you were working. So that would be a valid reason why you can reduce it immediately. Otherwise, if you don't do anything, it's always a 2-year look back. The letter goes out late in the year from Social Security explaining what your Part B premium is going to be for the following year. So those people making higher incomes, you're going to be familiar with what they call IRMA, Income Related Monthly Adjustment Amount. And the next slide is going to show you how you also pay an IRMA for Part D. Part D is the drug plan. So as this slide shows, if you make a little bit more money above $88,000 as an individual or $176,000 as a joint tax return person, then you're going to pay $12.30 IRMA plus the premium, if anything, for your Part D drug plan. One thing I like to point out about this, because people do ask a question a couple times, it's based upon joint income. So even though the spouse might not have any income, it's your joint income. So that's how that works. So that's the IRMA. So now the next slide is going to be talking about sections 4 and 5 in the Medicare You booklet. So section 4 talks about the different Medicare Advantage plans. Now here's another good example where all the information that's in this booklet is a nationwide booklet. It's not customized to your area, only in the very back when it talks about the plans that are available in this region. But when you look at this section, you're going to see things like MSA, Medicare Savings Account, that is, or PFFS. That's another type of Advantage plan. The first one, Medicare Advantage HMOs, those are by far and away the most popular, all nationwide, in fact. They're not available everywhere. Some people often get surprised. They're here, but if you're going to move up to, let's say, Weed, California, or some other outskirts, I only know Weed because someone was going to be moving there. There are no Medicare Advantage plans up there. And people are surprised at how good it is here for the Medicare Advantage plans in terms of benefits and design. So the second one, when you read about MSA or PFFS, those aren't here in California. It doesn't say that in the booklet, but they're not. And then there's a Medicare Advantage PPO option. It's not popular in California by design the way it is here, except for employer group plans. A very good example is the LA Unified School District. They offer a very good employer retirement advantage PPO plan, only available for those retirees. The one option that's available here has a relatively higher premium, and the way the costs are, it doesn't make good sense to go on that plan. And then section 5 talks about the Medigap policies. When you go on Medicare, in the larger scheme of things, you have two choices, because you see your Medicare is only going to cover 80% and you pay 20%. There's no cap on that 20%. So that's why people either join the Medicare Advantage side, where they have great benefits and low out-of-pocket costs. And that means the Medicare Advantage HMO, you use certain doctors and hospitals. And that's what Torrance IPA and Dr. Panich will touch upon. So the other option to protect yourself against the unlimited 20% are Medigap plans. And they use two terms simultaneously. A Medicare Supplement is also known as a Medigap. It supplements original Medicare. And a Medigap is the same thing. It helps cover the gap, the 20%. there's a lot of letters. There's 10 standardized letters, F, G, N. Some recent news over the last couple of years is that Plan F is no longer available. It's not a big deal. People think it's a major news story, but Plan F is, think of it this way, the full coverage. Everything's covered 100%. You're paying a big premium for that. And the reason why Plan F, it's been grandfathered for people who had turned 65 prior to January 2020. But as of January 2020, new people going on Medicare no longer can get F because the government wants to have the Medicare recipients to at least pay the Medicare deductible. The annual Medicare deductible is only $203. So Plan F covers that. Now, if you want the best plan, it's going to be G now. If you're going to be new to Medicare, you'll have to pay that $203 deductible. But if you look at the math between F and G at most nearly all age brackets, you're going to save $30, $40 a month on G. So anybody on F right now should consider G. You'll end up saving money in the long run. Then there's another option called the high deductible plan, either F or G. That's going to be the lowest premium you're going to get, but you're going to pay more down the line as you go. But it gives you a cap that Medicare doesn't give you. And currently that's $2,370. So it's wise to get some sort of protection rather than just having Medicare. And so that's what these two sections talk about. And with prescription plans, the other thing about those, the advantage of Medicare Advantage plans are how they include Medicare prescription drugs as part of the package, all in one. It's kind of nice. But then, of course, on the Medicare Advantage HMOs, you're going to be agreeing to use certain doctors and hospitals for all your routine care. You're covered anywhere in emergencies, but you have to use certain doctors and hospitals. A lot of people don't want that. They want more control and freedom to go where they want to go. Medicare supplements do not have the Part D program. So you have to pay extra for Part D. It's not a tremendous amount of money. There's things that work with the prescriptions in terms of co-insurance or co-payment, and maximum out of pocket is, as I said, what your worst case scenario is. I have to say, one bad thing about Medicare prescription drug plans is how the government doesn't have any out-of-pocket max for prescriptions. For most people, they're not going to be affected by this. But if you're one of the unfortunate few, maybe 5% or less, there are some really expensive cancer pills, not chemotherapy, that's covered under the medical part, but there are some cancer pills where you're going to be paying a lot of money, up to $8,000, $9,000 a year for that pill. It's really a shame. I think the government should really work on putting an out-of-pocket max for Medicare drug plans. So section 4 and 5 talks about all those type of things. And so I'm going to pass it on to Rose to talk about sections 6 and 7.
Vince, did you want to talk about the Medicare 101 tonight briefly?
Oh yeah, right over here on the right side. It was covered up on the screen here. For those of you who are interested in attending a Medicare 101 meeting, coincidentally, we're having one tonight. And there's the information on the right side, and it'll be mentioned again from Dr. Panich in the end. And join along, make this your education day.
All right, so on the next screen, yeah, it's a really good presentation, especially if you're interested in a Medicare Advantage plan, because Dr. Panich will talk more and more about the Torrance Memorial Group as well. So what we're going to do now is go to section 6 and 7, which is found on page 75. And it tells you here that there are 2 ways to get your prescription drugs covered. And that is either, as Vince was talking, a Medicare Supplement plan or a Medigap plan, along with a standalone prescription drug plan, Or you can get a Medicare Advantage plan. And this is where you have either a PPO or an HMO plan where your prescription drug coverage is included. You have to pay copays for your medicine depending upon what tier, how they're categorized by that plan. But the actual drug coverage itself is included. So generally for generic type of medicines like a tier 1 or a tier 2, there's either a $0 copay or maybe just a $5 copay, something like that. Okay, I want to talk a little bit about a late enrollment penalty, or LEP. And if you have the booklet, that can be found on page 79 of your booklet. A late enrollment penalty is basically a penalty amount that would be permanently added to your Medicare drug coverage premium. And you might owe a late enrollment penalty if at any time beyond your initial enrollment period, that 7-month time frame of when you turn 65, if any time after that period there's a period of 63 days or more in a row that you've not had Medicare drug coverage or prescription drug coverage. So we want to make sure that during your initial enrollment period, if you enroll in Medicare, that also includes your prescription drug coverage. Lots of people might say, well, I don't take any medicine right now, so why do I need a prescription drug plan? Well, that's true, but if you don't get one during that time period when you're enrolling in Medicare, and then you need one or you want one 2 or 3 years down the road, then there's going to be a penalty that's added to your cost on a permanent basis. So there's lots of different plans that you can get. If you need a standalone prescription drug plan, there's a plan that's $7.20 a month. And that would cover you in the event you needed an antibiotic prescribed or something like that. So we always talk to our clients about getting a drug plan and the penalties that you could experience if you don't get one. The next thing I want to talk about is something called extra help. And this can be found in section 7 on page 87. And extra help is for some people to help them reduce the cost of their prescription medicine. And actually everybody who enrolls in Medicare will be sent an extra help form to help with paying for your medicines. However, many people will not qualify because what Medicare does is they look at limited income and resources. So you have to be below a certain level of income and resources. Resources would include things like money in a checking or savings account or stocks or bonds or mutual funds, things like that. So certainly not everybody will qualify for extra help, but everybody would be sent a form. If you wanted to fill out, you could, but again, it's not, a lot of people will not be eligible for the extra help. Okay, and so I'll turn it back over to Vince.
Pretty good. Thanks, Rose. Okay, section 8. Now I have to say, if there's going to be one section you're not going to want to really read or pay attention to, it's this section. Because all of my years of doing this, I've never known anybody who had to file an appeal with Medicare. It's a lot of common sense information, which is good to read. You have a right to access your personal health information or how to protect yourself from identity theft. An appeal is where you're disagreeing with coverage or a payment decision by Medicare or the plan. Now, usually it's going to be a misunderstanding of something. A good example would be with cataracts. This comes up a lot. Cataract operations are quite common. And oftentimes the ophthalmologist offices will say, we can do your cataract, we remove your cataracts and we'll improve your vision with enhanced lens. Medicare doesn't cover that, nor does any plans. And so people are often surprised that that's not a covered benefit, and they may think they want to appeal that or take some action. But it's just a misunderstanding of what is covered and what's not covered. So that's what Section 8 is all about. And you can always call Medicare to get questions. Or I have to say also, in addition to this book, the Medicare website is fantastic in terms of information and what's there. So you can even find doctors on the Medicare website, providers. Sometimes that's a good source. If you go to the next slide, we're going to see talks about getting more information. I go to Medicare's website all the time. And it's interesting. I was just talking to one of my clients who is not on a Medicare Advantage plan. There's no list of doctors they have to use. They can go wherever they want. But then that was the part of the problem. Where do they go? And so they thought Medicare might publish a book of doctors. Well, Medicare doesn't. You go on the website, or like I told them, maybe you talk to your local hospital and ask them for doctor referrals. But Medicare's website, you can search for providers. You put in your zip code and you put in what type of doctor you're looking for, and a whole slew of doctors come up, which is very helpful. But it also, Medicare's website is good for lots of other reasons. And one thing I highly recommend is people create an account on their Medicare website, mymedicare.gov. When you go to the Medicare website, Medicare.gov, G-O-V, not .com, you'll be directed towards an insurance company. So Medicare.gov, there'll be a little place where you can create an account. And that is really good to do for all sorts of reasons. One of them is maybe your Medicare card is old and dilapidated. A lot of people are surprised. It's a paper card. It gets worn out pretty easily. Well, rather than calling Social Security, create your account online and you could print out your card or you can also order a card. But one of the most important reasons why I am really going to be encouraging people to create their own Medicare account is for the drug plans. Medicare drug plans are always a surprise for people. If you're just taking generic drugs, you're going to be fine. But throw in one brand name and it goes haywire. It can be convoluted and confusing with the design of Medicare drug plans. Similar to what I said before, how there's no max out of pocket on prescriptions. You're always going to be paying something. You don't reach a limit. Granted, maybe that something, if you reach that catastrophic level, might only be 5%, but 5% off a pill that's $10,000 is going to be a lot of money. But the Medicare website gets updated. They have a plan finder. Now, it's not a very easily navigated plan finder, but if you get the hang of it after a while, you can search for drug plans or advantage plans, and that always gets updated October 1st, because October 1st is when the following year's Medicare drug plans, advantage plans are released. So between October 1st and October 14th, that's when you can shop around for the plans, but you don't take any action until the 15th of October. It goes from October 15th through December 7th. And if you do make a change, the new plan will start January 1. It ends December 7th because that gives the new plan that you're changing to plenty of weeks to get all your information and your new ID card in the mail by the time January comes. But with Medicare drug plans, that's where it's really valuable, because you'll be able to see exactly, there's 32 drug plans if you're on the Medicare Supplement side, and there's many Medicare Advantage HMO plans, but you put your prescriptions in and it's intuitively going to bring up the most cost affordable plan for you with your drugs. And you can, that's the most confidence I can tell you about, because oftentimes people, they don't understand why it's not as good. The drugs aren't as good as when they were working, covered under a work plan. Unfortunately, that's one area that has some issues, especially if you happen to be taking some brand names. One brand name could do it, like Humira. You might hear that one advertised. So I would encourage you to create a mymedicare.gov account. Oh, and another thing I want to mention, because there was a reference to this in a chat, as I'm sure a lot of you will, if you watch TV, you'll be able to agree with this, the Joe Namath commercials. You know, call the Medicare hotline and make sure you get what you deserve. And it's all red, white, and blue, and Medicare. It's, you know, at first I was thinking, oh, is Medicare doing an advertisement? It's not Medicare. It's not the government. I was a little shocked that they were allowed to do that, but they were. And so if you call that number, it's inside insurance agents. It's a call center, and they're wanting to get you to change your plan. They want your business. They're going to either change your HMO or get you in a drug. They want to change your business. So it's not the greatest place to go to, in my opinion, and it's very deceiving. You know, hopefully maybe those commercials won't be going on this year, but I probably think they might. I think one reason why they were so popular last year is because of the pandemic. Typically, a lot of the insurance companies and agencies, they might have restaurant presentations. Now, they were banned from giving out free meals. That was a few years ago, because people would change a plan because they got a nice sandwich and French fries, and they were changing frivolously and not for a really good reason, or maybe they didn't even realize they were changing one thing, but then it affected something else. So it's very tricky about changing plans oftentimes. Of course, at the end of the year, if you don't do anything, it just rolls over to the following year without doing anything. So that's section 9 about getting more information. Then section 10 is a really good section. It's a quick section. It's about definitions. That's going to be the next slide. And what I like about it is that first bullet point, a co-insurance versus co-payment. Sometimes I'll ask people, what's the difference? Typically, nobody's going to know. Well, it's easy. Co-insurance is a percentage. Co-payment is a flat dollar amount. And particularly with drug plans, the way they're designed, tier 1 or tier 2 drugs are going to be co-payment. And it's easy to understand. You're going to pay $5 or maybe $0 if many generics are zero cost, or $10. Well, the tier 3 and 4, those, especially tier 5 and 6, there's these percentages like 33%, and it's random. It may be 33% of the drug cost 1 month, and that drug cost that is going to be applied is $540, let's say it's never going to be even dollar amounts. It usually be $541.12, and then you're going to be paying, let's say 25% of that. Well, the following time you're going to go in, and then all of a sudden that drug cost is going to be 25% of $560. So the coinsurance is tricky because it's not predictable, but that's what exists. And that's how you'll know if somebody refers to coinsurance or copayment. Copayment's a good thing. It's more logical. And then there's a definition of a credible drug plan, or a deductible. You know, surprising, a lot of people don't really know what a deductible is or how it works. Like that $203 annual deductible that Medicare has if you just have straight original Medicare. People say, well, can I pay it now? It's like, well, no, what you do is the first time you're going to a doctor, if you only have Medicare, well, your first doctor visit might be $80.22. You're going to get a bill from the doctor's office after they submit it to Medicare. And then you're going to pay that bill to the doctor. Well, you have another $120 left before you reach your $203 deductible. So that's what a deductible is. A formulary is another term that you'll read about. A formulary is a fancy word for a list of prescriptions. And not every drug plan has the same formulary. One plan might put Restasis, for instance, the common eye drops. One company might put Restasis on a tier 3. Tier 3, the lower the tier, the better for you in terms of what you're going to pay. Restasis is a brand name. So it wouldn't be a tier 1 or 2. Restasis would be a tier 3 on many companies. And that's where generally tier 3 is going to be a copayment. So that might be $40 for a month's supply. Well, another company could put that same drug on a tier 4, and then you're going to be paying perhaps 25% of the $500. So it's going to be more money. So formulary is a term that it's good to know about. And what's medically necessary versus not medically necessary. Of course, you know, things have to be medically necessary to be covered. So that's section 10, a quick section on definitions. So then the next slide talks about the very end of the booklet. So in the booklet, you're going to see a whole list. It starts off with Medicare Advantage and other plans in Southern California. Now, come to think of it, I'm not sure why they say other plans, because these are all Medicare Advantage plans. They don't list Medicare supplements. These are all Medicare Advantage. Medicare Advantage means you're signing over your Medicare to an insurance company who takes control of that. And you won't be paying the 20%. They'll have different designs. And many of the, like as I said in the beginning, the Medicare Advantage plans in LA and Orange County and Southern California, the Medicare Advantage HMOs are by far in the leading way to go. A lot of times people will say, well, what percentage of people join one Advantage versus the other? You know, it's difficult to say. In the South Bay area, where people have higher incomes and it could be 50-50 here, depending upon the region, of course, and depending upon the person. But the Advantage plans are extremely popular in this area because both hospitals, a group of very well-established doctors belong to the Advantage plans. And some people just, it's not a good fit for them. Maybe they live here 6 months, somewhere else 6 months, and an Advantage plan is not a good option. But this whole list here, it's a bit overwhelming, I got to tell you, even from my perspective, because they're listing, if you go on Medicare's Plan Finder even, you'll see 56 Advantage plans. Well, this is because there's not 56 companies. There's only 13 insurance companies. But every insurance company has some other Advantage programs. Some programs are for people with diabetes or heart conditions or pulmonary issues. And basically, the reason why they came up with those plans is because it's another way to avoid the lock-in rule where people can only change once a year. Well, if somebody has one of those underlying conditions, they can change mid-year. That's why they came up with them, essentially. Sometimes there are some added benefits if you have certain of those illnesses. And then there's Medicare Advantage, Medi plans. That's people who have Medicare and Medi-Cal together. And now, oftentimes, people with Medicare and Medi-Cal, if they have that, I say, you're fine, you're good. But if you will join it, if somebody who has a Medicare and Medi-Cal and they're not paying, they're not even paying their Part B premium if their income's low enough, because the government's kicking in, state of California, and helping pay that Part B premium if you have low income. But if you do join a Medicare Advantage plan and you're a Medi person, you'll get some nice extra benefits. You get $500 for eyeglass allowance, you get transportation, all sorts of extras like Joe Namath talks about, the Medicare extras that people get on Medicare Advantage plan. So in the back of the book, you could browse through it for an overview of what's there. And it gives basic benefits in terms of how they're covered. So that's always good to look at. And for those of you that are going to be with just Medicare by itself, this is great. In the very back, it lists the Medicare drug plans. Those of you who are not going to be on Medicare Advantage and you are going to be staying with original Medicare, it lists all the drug plans. It lists their premium, whether or not they have a deductible or not. One comment about that. There's some plans that do not have a deductible for Medicare drug plans if you're going with straight Medicare. Invariably, when I put in people's prescriptions, those plans without a deductible for brand names are never the most cost effective. It's just about always, I have to say, everybody, if you're going to stay with straight Medicare and buy a drug plan, you're going to want to go with the deductible plan. They're as low as $7.20, but it, of course, has a $425 deductible, but only for brand names. And that's why it'll say here for some drugs. It doesn't explain which drugs. And along with that comment, there are some generic drugs that are not a tier 1 or tier 2, and they're subject to a tier 3 where there's going to be a deductible. Once again, it's an example of some of the confusion that can go on with Medicare prescription drug plans. But here you'll get an overview. But once again, this doesn't tell you how it handles your prescriptions. So that's why that Medicare Plan Finder is extremely important, because it'll identify your most cost-effective plan when you join a Medicare drug plan, and it helps with Medicare Advantage HMOs. It'll show you what tiers you're on in terms of your drugs. So this is the book. You have the textbook. If you don't have it now, you can download it on Medicare's website. You can call Medicare and ask them to send you one. It's too bad. At one time, Medicare's website used to be able to click and you could order one online. Well, now it's just downloadable. So if you really want one, you have to call Medicare. They're making it harder, saving paper, which is a good thing. Or be on the lookout later in the year. So now I'm going to introduce Dr. Panich. He's the chairman of Physician Council and one of the original founders of the Torrance Memorial Independent Physician Association, founded in 1983. A wonderful group of physicians, and if someone's interested in joining a Medicare Advantage HMO plan, that's a fantastic plan. So take it away, Dr. Panich.
Dr. Panich, you need to unmute yourself.
We're unmuted now.
We're unmuted.
Yep.
Can you hear me?
Yes, we
Okay.
can hear you.
Can you hear me?
Yeah, perfect.
Yes.
So I said there may be 57 Advantage plans, but I'm going to tell you about the best one, and it's local. Back in the early 1980s, I didn't even know what an IPA was. I was chief of staff of Torrance Memorial Hospital at that time. It was a tiny hospital. And we were approached by the administration to form an IPA, an Independent Practice Association. And in that era, it was very, very difficult to do because HMO medicine had a very bad name. Everyone thought, people had this feeling that you couldn't get to a specialist. You couldn't get the medication that you needed. If you wanted to go to a specialist, it would take you months to get to a specialist. So it was very difficult in the early 80s to do this, but myself and a group of other doctors put it together. We strong-armed about 20 doctors to come in for $75 each, and we formed Torrance Hospital IPA at that time, because it was not Torrance Memorial Medical Center at that time. I guess I'm aging myself, but I went into practice in 1975, and it was a tiny hospital. It didn't have any of these advances that we've had. So we're an IPA. We're a nonprofit, multi-specialty network, and we're now, for the first time, a division of Torrance Memorial Medical Center. And that occurred about 8 years ago when we were independent of the hospital, but the hospital realized that they needed a strong IPA to do a lot of this new Medicare Advantage business. And I will tell you that Medicare Advantage is the fastest growing portion of Medicare. More and more people are going into Medicare Advantage. The cost differential is dramatic, and the care, we feel, is as good easily as Medicare fee-for-service or maybe even better, because it's monitored, because it's coordinated. So what is the difference? Why is Torrance Memorial IPA different? Well, we have an enormous amount of primary care physicians and specialists, and we are getting more and more young, well-trained primary care physicians to join Torrance Hospital IPA. We have every specialty imaginable. We've been here since we debate this, either 1981 or 1983. Those are the years that I was chief of staff of the hospital. As a little background, I'm now retired. I practiced for about 40 years as a gastroenterologist in South Bay GI Medical Group. I'm sure many of you have come to me or my partners. Convenience, critical. We are the only IPA probably in the country which offers members self-referral. So what does this mean? This means if you are riding your bicycle and you feel some vague pain in your chest, you don't go to your primary care physician. You can go directly to our cardiology panel, any cardiologist that in our group, and we have a large selection of cardiologists. So do you understand? It's direct patient referral. Let's say you have SCAN or one of our other insurance companies. You would say, I'm a SCAN Torrance Hospital IPA patient. You're saying to the cardiologist, and you go right in. You skip that step of going to the primary care doctor. And this was the major drawback to the HMOs that were formed in the early 70s and 80s. Also, the difference, we are affiliated with a teaching hospital, Cedars of Sinai Medical Center, which was voted, I think, in the top 3 in Los Angeles. And I will tell you why that is important. So again, I wanted to emphasize we're the only medical group, certainly in the South Bay, offering member self-referral. And this was hard to get across because the doctors said, oh, everybody's going to be coming. Everybody's going to be trying to get in. And I said, no, people are smart. They're only going to go to these doctors when they need it. So these are the groups that encompass member self-referral. The number one that we picked was cardiology. I didn't want anybody getting a heart attack. I wanted people who are having angina to get to their cardiologist. Dermatology. Somebody saw a mole on their arm and they're worried that this could be a melanoma. We don't want them to wait. We go directly to the dermatologist. Gastroenterology, that was the first group that we got member self-referral. I was running the group at that time. I said, we're joining it. We're going to do member self-referral. That means if somebody had problems swallowing, if somebody was bleeding from the gastrointestinal tract, if someone needed a colonoscopy at age 50, they would get their colonoscopy. As an aside, African Americans get this disease much earlier and much worse. No one knows why, but we like to screen those patients at 45. And I think that's a smart idea. I would like it down to 40. GYN, direct referral. Podiatry, we put in because of the diabetics. We did not want them to have infections in their toes and their feet. We didn't want to get amputations. We put in podiatry. And now with the virus, with COVID, we have pulmonology as a direct referral. That avoids the need for you to go to a emergency room or an urgent care center. You would just pick up the phone, again, say, I'm a Torrance Hospital IPA scan member, Humana member, one of our plan groups, and you would go directly to the pulmonologist. Same thing with urology, male and female. And then we have something, a category, a new category, care management for members with chronic severe health conditions. We have an entire department related to helping our elderly patients at home. We even have house call doctors going to the home. We're trying to keep our patients at home, not bring them into the hospital. Next slide, please. Let's talk about quality. On the left, you could see the U.S. News and World Report. We were ranked number 12 in Southern California. The only ones who were ahead of us were the teaching hospitals. As a matter of fact, Torrance Memorial was voted the number one non-teaching hospital, best community hospital in the United States. And we're moving up. Once the publication from the Daily Breeze comes out, you will see how the hospital is now ranked, certainly ranked best in the South Bay, and our group was voted best in the South Bay. The competition is below us. On the right, Newsweek, we're number 10. Who's ahead of us? UCLA, Cedars, Scripps, Keck, and UC San Diego. These are all teaching hospitals. But we're number 10, but we're now associated with Cedars, which is number 2. And I'll tell you why that's important. Torrance Memorial is recognized for quality. We have a comprehensive stroke center, and that could not have been done without Cedars, because we now have one of their neurovascular surgeons. Stroke used to be permanent instantly. People felt that if someone awakened from sleep and they had paralysis of their arm or their face, or they couldn't speak, there was no way to improve it. Well, now we can improve it if you get to our hospital quickly, because we have this stroke center. We have the finest interventional radiologists who work with the neurovascular surgeon, and clots can be in the brain, can be dissolved, can be removed, and we can reverse the dire effects of a severe stroke. What does this affiliation mean with Cedars? It's now been going on couple of years. I'd say five years we've been affiliated. Well, it means we have, number one, a strong clinical partner in neurosurgery, as I mentioned, the endovascular procedures, and very important, cardiothoracic surgery. So you don't have to, if you had a heart valve problem, you used to have to get on the 405, take El Segundo, and get all the way up to Cedars to have your heart surgery. Well, we've brought down their heart surgeons. So those difficult valvular problems with the coronary arteries, can now be done at Torrance Memorial Hospital. And the last is the cancer clinical trials. You need to be a teaching hospital to do good work in cancer clinical trials. That means you're exposed to these new incredible drugs that are now coming out, which are little by little replacing the standard chemotherapy drugs, which we all know have significant side effects. We're now doing studies on monoclonal antibodies, something called CRISPR, which changes, actually can find the gene for the cancers. These are clinical trials that we can put you in because of our affiliation with Cedars. We do our third opinions, tertiary opinions at Cedars, which means that if our doctors cannot figure out what's wrong with you, and you go to another doctor in our group and they can't figure it out, we will then send you up to Cedars and have their doctors evaluate you. And that's a teaching hospital with professors and house staff, an excellent relationship. And it's my hope that in my lifetime, I will see Torrance Memorial Hospital have interns and residents and fellows, and we're going in that direction. What it is not, this affiliation, is a combination of the doctors. So if you join the Cedars IPA, you're in Cedars. You join our IPA, you're in our IPA, unless you're sent back and forth. Cedars can send to Torrance, Torrance can send to Cedars. Next slide, please. We have member services. Medicare fee-for-service, which is standard Medicare. There's nobody to call. There's nobody to call. Who are you going to call? Biden? You can't. Who are you going to call? But here we have member services, which is just a phone call away. And I've always had a pet peeve. I want a human being to answer the phone. I do not want to stay on the phone for 3 hours waiting for Cox to come on to come fix my television. So we have a actual representative that'll answer the phone, that'll help you find a doctor, verify your eligibility, billing, authorization. This is a tremendous advantage to have in Medicare Advantage. And Medicare Advantage is Part C of the Medicare alphabet. And if you tune in tonight at 6:30 to Medicare 101, we'll go through Medicare A, B, C, and D. We'll take it to the basics. I think what you heard from Vince and Rose was absolutely spectacular, how they went into the deeper questions of Medicare. But tonight, we're going to do the basics. We're going to do the basic A, hospital, B, doctors, C, us, Medicare Advantage, D, easy, drugs. That's tonight. So we hope that you'll come back and join us. Next slide, please. We are so senior-centric. We have a senior advisory board. We listen to our seniors, their problems. We know when they're in the hospital, they'll tell us about their experience, and we'll correct any problem that may occur with our seniors. We are very senior-centric. So we call this the circle of health. You're in the middle, you're a member, you get a primary care doctor, you're surrounded by Torrance Memorial Medical Center, one of the finest hospitals in the United States. We've been here for over 30 years. We accept the major health plans. We have member services, discounts at the hospital, and we have 2 urgent care centers. Do we have a slide on that? The urgent care?
Yes, it'll be next.
Yeah, we have 2 urgent care centers to avoid any long wait in the emergency room, but waits are not that bad at Torrance Memorial. They really can get you in quickly. And then we have care management that I mentioned, and then we have virtually every primary care doctor in the South Bay. Remember when I said when we started, we were twisting arms to get in? Well, now there's a waiting list of doctors who are trying to get into Torrance Hospital, IPA. Here's a picture of our urgent care centers. We moved the one from Hawthorne Boulevard and Sepulveda. I built that one when I was president of the original Torrance Hospital IPA, and that was an excellent urgent care center. And we've moved it near the hospital for convenience. So as you head towards Lomita Boulevard, you can go to the urgent care center. Across the street from that is the specialty center. And then we have, of course, Manhattan Beach. And we are very, very advanced in our locations now. We're in Hermosa Beach on Pier. We're in Manhattan Beach, in Manhattan Beach Boulevard, and we'll be soon opening a center in El Segundo, which is very exciting. And we're also moving east into Carson. So we're covering the South Bay and more, north and west. Here we go. Here is the El Segundo Nash Street Center, which will open very soon. We'll be doing primary care, urgent care, laboratory. Specialists will be rotating through. In fact, I met with my old group, and they will be rotating through El Segundo. We have an endoscopy center to do colonoscopy and upper endoscopy. It will also have imaging with CAT scans and ultrasound, and best of all, free parking. So it's going to be really exciting opening up the El Segundo location.
And that'll be March of 2022. That's a typo there. We got to change.
We got a typo, March of 2022. It's a year away. So it's important to know in closing that our IPA is not your insurance company. Look on the right. Those are the insurance companies that we deal with: Aetna, Blue Shield, Humana, Anthem, HealthNet, and Scan. These are the best. So you join one of those, and they will then put you into Torrance Hospital IPA. We contract with the major insurance companies that offer Advantage, approved by the Center for Medicare Services, and they provide the benefits, and Torrance Memorial IPA, we provide the care. So if you're ready to join us, we would love to have you. If you're new to Medicare, you can join one of those plans that we just showed you. If you already have Medicare Advantage, you can switch your medical group to us. And when in doubt, you call Linda at 310-257-7239 or 310, again, 257-7239. So tonight, we're going to go into the Medicare basics and the Medicare Advantage plans. I'll expand on what we're talking about today, this morning. I didn't get into the Torrance Memorial Network, which I will talk about tonight, which is a mini Kaiser within our group. So tonight, look at the link, and I'm sure that you received this link with the meeting number.
And you could also go on our, sorry to interrupt, Doctor, you could also go to our website, to MIPA.org, and just horizontally there you will see a link for events. You'll find the information on that on our webpage as well.
Yeah, I've had a lot of friends do that, and they go right on. So we're going to move on to questions and answers for Rose, for Vince, and for myself.
we may be good. We chatted a lot with comments,
We might have addressed them all, Vince. It looks like you,
perhaps.
yeah.
It looks like you got all the questions and answers taken as well. A lot of people are just saying thank you for the great session.
Good, maybe we'll see some tonight.
Well, that's great. Well, thank you guys for a great presentation. We had wonderful turnout, and this, as we said, this will be taped and sent to all attendees, as well as Torrance Memorial IPA. They'll have it put up on their websites, as well as the Southern California News Group. So thank you all for attending.
Thank you, Daily Breeze,
Thank you.
and have a wonderful health fair.
Thank you, Doctor.
I love the Daily Breeze. I subscribe.
Yay. Have a good one, y'all.